Managing chronic kidney disease is not just about treatment in the medical sense. It's about making lifestyle changes, understanding what your body needs, and, most importantly, how to give it exactly that. Whether you or a loved one are navigating chronic kidney disease, today's video is all about empowering you with knowledge and practical steps. We'll explore the treatment options available, including when to consider dialysis or a transplant. But treatment is just one piece of the puzzle. Diet plays a crucial role in managing CKD, and we'll break down which foods to embrace and which to avoid to support your kidney health. So watch this to the end to get all the information, and do not forget to like and subscribe. And, because knowledge is power, we'll also guide you through the diagnostic process. Understanding how CKD is diagnosed can help you advocate for yourself or your loved ones in medical settings. Hi, if you are new to my channel, I am V, and welcome to the best health channel on YouTube, where we talk about everything related to your health and well-being. Navigating CKD can be challenging, but you're not alone. Today, we're here to guide you through these challenges, offering insights, tips, and real-world advice to help you manage CKD effectively. So, let's get started and take another step towards better health and well-being. Are you ready to dive deeper into managing CKD? Let's go! When it comes to managing chronic kidney disease, understanding your treatment options is key. The right approach can help slow the disease's progression, manage symptoms, and maintain quality of life. Let's explore the most common treatments for CKD. Lifestyle changes and monitoring. For those in the early stages of chronic kidney disease, lifestyle changes and regular monitoring can make a significant difference. This includes managing blood pressure and blood sugar levels, eating a kidney-friendly diet, staying active, and avoiding substances that can harm the kidneys, such as NSAIDs and certain antibiotics. Watch my first video on 11 signs of CKD to know more about the stages. Medications. Medications play a crucial role in managing CKD. Depending on your situation, your doctor might prescribe medications to lower blood pressure, control blood sugar, reduce cholesterol, treat anemia, or relieve swelling. It's crucial to take these medications as prescribed and discuss any side effects with your healthcare provider. Advanced treatment options. As CKD progresses, more advanced treatments may become necessary. Let's discuss two key options: dialysis and kidney transplantation. Dialysis. Dialysis takes over the job of filtering and purifying the blood when your kidneys can no longer do the work adequately. There are two main types of dialysis: hemodialysis, which involves a machine and usually takes place in a clinic, and peritoneal dialysis, which can be done at home. Both have their advantages and considerations. Kidney transplantation. Another option is a kidney transplant, which involves receiving a healthy kidney from a donor. It's a significant surgery and requires taking medications afterward to prevent your body from rejecting the new organ. While a transplant can offer a more normal life, not everyone is a candidate, and there can be a long waiting list for donor kidneys. Supportive care. For some, the focus may shift to supportive care, especially in advanced stages. This includes managing symptoms, ensuring comfort, and maintaining the best possible quality of life through various therapies and services. Navigating treatment options for CKD can feel overwhelming, but you're not alone. Every step you take towards understanding and managing your treatment is a step towards better health. Have you or someone you love faced these treatment decisions? What was your experience, and what advice would you share with others starting this journey? Let's support each other by sharing in the comments below. Remember, the best treatment plan is one that's tailored to your individual needs and circumstances. Working closely with your healthcare team is essential to navigate the complexities of CKD management successfully. Expanding on the medical treatment options for chronic kidney disease, CKD, particularly focusing on medications, is crucial for understanding how to manage the disease effectively. Medications play a significant role in controlling the symptoms and progression of CKD. Here's a detailed look at some of the key medications and their roles. Medications for chronic kidney disease. When managing CKD, a variety of medications can be used to address different aspects of the disease. It's important to understand what each medication does and why it might be part of your treatment plan. Blood pressure medications. ACE inhibitors, angiotensin-converting enzyme inhibitors, and ARBs, angiotensin II receptor blockers. High blood pressure is a common issue for those with CKD. ACE inhibitors and ARBs are two classes of medications that help relax blood vessels, lowering blood pressure. They also provide the added benefit of reducing proteinuria, which is protein in urine, which can help slow kidney damage. Blood sugar control. Metformin and insulin. For patients with diabetes, controlling blood sugar levels is paramount. Metformin is often used for type 2 diabetes management, while insulin therapy may be necessary for type 1 diabetes. Proper blood sugar control can slow the progression of CKD related to diabetes. Cholesterol-lowering medications. Statins. CKD increases the risk of heart disease. Statins can lower cholesterol levels, reducing the risk of heart attacks and strokes. It's about protecting your heart as much as your kidneys. Anemia treatment. Erythropoiesis-stimulating agents, ESAs, and iron supplements. Anemia is a common complication of CKD. ESAs help stimulate the production of red blood cells, while iron supplements can also be necessary if you're iron deficient. Together, they combat fatigue and weakness associated with anemia in CKD patients. Mineral and bone disorder treatment. Phosphate binders and vitamin D supplements. CKD can lead to mineral and bone disorders. Phosphate binders help reduce the absorption of phosphate from your diet, preventing bone disease. Vitamin D supplements can also be important for maintaining bone health and proper blood calcium levels. Diuretics. Loop diuretics. Fluid retention is another issue that CKD patients may face. Diuretics, also known as water pills, help the body remove excess fluid, relieving swelling and preventing fluid overload. Managing CKD often means taking a combination of these medications, tailored to your specific needs and stage of kidney disease. It's vital to work closely with your healthcare provider to monitor your condition and adjust your treatment as necessary. Remember, these medications can help manage CKD, but they work best when combined with lifestyle changes and regular medical checkups. Dealing with medication can be a challenge, but it's a key part of managing CKD. Have you had experience with any of these medications? How have you managed the balancing act of multiple treatments, and what tips do you have for others? Sharing your experiences can provide valuable insights to those navigating similar paths. Let's discuss in the comments below. Moving on to the dietary recommendations for chronic kidney disease, CKD, management, let's delve deeper into the specifics of what foods to eat and avoid. This detailed guidance can help you tailor your diets to better support kidney health and manage CKD progression. Foods to avoid in CKD. Processed meats. High in sodium and phosphorus, processed meats, like sausages, deli meats, and bacon, can increase blood pressure and worsen kidney strain. Dairy products. Dairy is rich in phosphorus, which can be harmful in excessive amounts as CKD progresses, leading to bone health issues. Dark-colored colas. These beverages often contain high levels of phosphorus additives, which can contribute to an imbalance in phosphate levels. Avocados and bananas. While healthy, these fruits are high in potassium, which can cause problems if your kidneys cannot remove excess potassium efficiently. Whole wheat bread. Compared to white bread, whole wheat options are higher in phosphorus and potassium, which might need to be limited depending on your stage of CKD. Foods to eat in CKD. Cauliflower. A versatile vegetable that's low in potassium but high in vitamin C, folate, and fiber. It can be a great substitute for potatoes or other higher potassium vegetables. Blueberries. Rich in antioxidants and nutrients while being lower in potassium, making them a great choice for a kidney-friendly diet. Egg whites. High-quality protein source with less phosphorus than other protein sources like meat and whole eggs, making them ideal for CKD patients. Garlic and onions. Excellent for adding flavor without the need for salt, garlic and onions also offer antioxidant properties. Arugula. A good alternative to higher potassium leafy greens, arugula is kidney-friendly and adds a peppery flavor to salads. When it comes to managing CKD through diet, the goal is to minimize the kidney's workload and prevent waste buildup in your blood. This involves careful consideration of your intake of potassium, phosphorus, protein, and sodium. But it's not just about avoiding certain foods. It's about finding balanced and nutritious alternatives that support your overall health. Adjusting your diet for CKD can seem daunting at first. Have you discovered any kidney-friendly recipes or substitutes that you enjoy? Sharing your culinary discoveries can inspire others to embrace a healthy diet that supports kidney health. Remember, every individual's needs can vary, especially when it comes to CKD. Working with a healthcare provider or a renal dietitian can help you develop a meal plan that's right for you, ensuring you get the nutrients you need while managing your kidney health. How to diagnose chronic kidney disease. Catching chronic kidney disease early can make a significant difference in managing the condition and slowing its progression. But how is CKD diagnosed? Today, we're going to walk you through the diagnostic process, so you know what to expect and when to seek testing. Initial evaluation. The diagnostic journey often begins with a review of your personal and family medical history, coupled with a physical examination. Your healthcare provider will look for signs that suggest kidney dysfunction and ask about any symptoms you might be experiencing. Blood tests. A blood test to measure serum creatinine, a waste product from muscle activity, is crucial. High levels can indicate kidney dysfunction. This measure is used to calculate your glomerular filtration rate, GFR, which tells us how well your kidneys are filtering blood. Urine tests. This test checks for albumin, a type of protein in your urine, which can be a sign of kidney damage. Normally, protein should not be present in urine, so finding albumin can be an early indicator of CKD. Imaging tests. Imaging tests like ultrasound or CT scans can provide images of your kidneys, revealing abnormalities such as kidney stones, tumors, or structural issues that could indicate CKD. Kidney biopsy. In some cases, a kidney biopsy might be necessary. This involves taking a small sample of kidney tissue to examine under a microscope. It helps to determine the type of kidney disease and the extent of damage. Diagnosing CKD early is crucial for effective management. If you're at risk due to conditions like diabetes, high blood pressure, or have a family history of kidney disease, don't hesitate to discuss screening options with your healthcare provider. Undergoing the diagnostic process for CKD can be a challenging experience, both emotionally and physically. If you've been through it, sharing your story could help others facing similar journeys feel less alone. What was the process like for you, and how did you manage? Let's open up the conversation in the comments below. Remember, knowledge is power. Understanding the diagnostic process for CKD can empower you to take proactive steps towards managing your health. Stay informed, stay engaged, and take action for your kidney health. Additional considerations for CKD management. While we've explored treatment options, dietary adjustments, and the diagnostic process for CKD, managing this condition extends beyond medical interventions. Let's touch on some crucial areas that support overall well-being for those living with CKD. Emotional and psychological support. Facing CKD can be a challenging journey, not just physically but emotionally too. It's essential to acknowledge the emotional weight of chronic illness. Seeking support from mental health professionals or joining CKD support groups can provide solace and understanding. Remember, taking care of your mental health is as important as managing your physical health. Lifestyle adjustments beyond diet. Adopting a healthy lifestyle plays a significant role in supporting kidney health. Regular exercise, stress reduction techniques, and avoiding harmful habits like smoking and excessive alcohol consumption can have a positive impact on your CKD management. Small, consistent changes can lead to significant benefits over time. Navigating healthcare. Navigating the healthcare system can be daunting. Being prepared for your appointments, having a list of questions for your healthcare provider, and understanding your treatment options can empower you to take an active role in your care. Don't hesitate to advocate for yourself and seek second opinions if needed. Financial and social resources. The financial aspects of managing CKD can be overwhelming. Explore medication assistance programs, insurance options, and community resources designed to support individuals with chronic conditions. Equally, lean on your social network. Friends, family, and community organizations can offer invaluable support and assistance. As we conclude this video on treatment of chronic kidney disease, it's clear that managing CKD is a multifaceted journey that touches every aspect of life. From understanding your treatment options and making dietary changes to addressing the emotional and lifestyle factors, it's all part of navigating this path. I want to extend a heartfelt thank you to each and every one of you for joining us on this journey. Your engagement, stories, and willingness to share have not only enriched this series but have also provided hope and support to others navigating similar paths. As we continue to explore and discuss CKD, remember that your journey is unique, and there's strength in seeking knowledge, support, and connection. Please keep sharing your experiences, questions, and the topics you'd like us to cover next. Stay tuned for more informative content, and don't forget to like, share, and subscribe to help spread awareness and support others in our community. Your health and well-being are worth every effort, and we're here to support you every step of the way. Until next time, take care of yourselves and each other.